Right, a very good afternoon, ladies and gentlemen. We welcome you to our live session on hair wellness. I'm Deepti Diwan, your host for today, and today we shall be talking about hair care in winter. Well, our hair is our crowning glory, and it symbolizes our personality and tells people so much about us. Having strong and healthy hair can indeed boost our confidence. So it's very essential that we protect our hair and keep it looking gorgeous every single day in all seasons. This winter, let's care about our hair from the roots to the ends. And today, we have the opportunity to engage in a conversation with consultant dermatologist Dr. Radhika Kopikar. Dr. Radhika Kopikar is MBBS, DDVL, MD, founder and medical head of Kopikar Dermatology Skin, Hair and Laser Clinic in Mumbai. She's a consultant at Godrej Memorial Hospital and Sushustra's Suman Ramesh Tulsiani Hospital in Mumbai. Dr. Kopikar is a life member of Indian Association of Dermatologists, Venerologists and Nephrologists, a life member of Cosmetic Dermatology Society India, and also a member of European Academy of Dermatology and Venerology. Dr. Kopikar has received many awards. She was crowned the Gladrags Mrs. India Maharashtra 2018. She has been a national swimmer in 2003 and a district and state swimming champion from 2001 to 3. And she's received the International Sensitive Skin Expert Diploma by the World Health Academy. Welcome, Dr. Kopikar.
Thank you. Thanks for the welcome.
Doctor, our viewers are looking forward to talk to you today and to understand how they can look after their hair. So, आज हम बात करेंगे hair care के बारे में. And one of the most common conditions that people face during winter is that of dandruff. So, doctor, please tell us what exactly is dandruff?
Yes, dandruff is one of the very common conditions which we encounter as specialists in our clinic during the winter months. And dandruff is basically a skin condition of the scalp where we see a lot of flaking happening. So a lot of white flakes happening. It can be associated with itching or pruritus. Some patients also have redness on the scalp along with that. It is seen to be more common in males than in females. And a lot of other factors are also involved, especially increased sebum production.
Okay.
The flakes that we see in dandruff are basically the loose keratinous cells, which have a shorter renewal time. So a lot of them keep forming again and again and in excess. So they keep shedding off.
Okay. And doctor, people who suffer from dandruff, they really dread the winter season. So what is the link between dandruff and winter?
So the basic link between dandruff and the winter season is the dryness of skin. We have a generalized dryness of skin during winter months, and the same applies to our scalp skin as well. So the scalp also tends to be very dry during the winter months, and dryness is known to exacerbate the dandruff situation. So a lot of patients come to us during winter months with an increase in the dandruff severity.
Okay. Thank you, doctor. And what is the difference between dandruff and dermatitis?
Yes, seborrheic dermatitis and dandruff are quite interchangeably used. And seborrheic dermatitis is more like a medical term used for dandruff. And there is a school of thought which also says that dandruff and seborrheic dermatitis are basically the same thing, differing only in their severity. So dandruff is when we see a milder form of seborrheic dermatitis where there is no inflammation. So it is a non-inflammatory form or a subclinical inflammation where the patients don't have as much itching as in seborrheic dermatitis, not much redness, and they are symptomatically better than in seborrheic dermatitis. So dandruff also is only limited to the scalp area, whereas the seborrheic dermatitis may extend to other seborrheic areas of the body away from the scalp. So dandruff is a milder form, non-inflammatory kind of seborrheic dermatitis, whereas seborrheic dermatitis is kept at the other end of the spectrum where it is more severe.
Okay. Doctor, could you please elaborate a little more if a person is suffering from dandruff and say they have a little or minor itching, how do they know that it has not reached a stage like seborrheic dermatitis? Is it just inflammation or are there other conditions also?
So dandruff can also be associated with itching, right? Because there is an excess of sebum production. There is an infection with a yeast called Malassezia, which also leads to this kind of pruritus and itching. So dandruff happens with itching, without itching. And if you have a irritation on, I say, any part of your skin, if you have any itching or irritation, don't ignore it more than 7 days. You can try certain things at home, but not after 7 days. If it has been there and staying with you for a long time, you should get an expert advice, because we need to differentiate dandruff from many other skin conditions also. Every time the scaling and the itching on your scalp cannot be called as dandruff. Sometimes it is dandruff. It can be seborrheic dermatitis, as we understood that it's a more severe form. Then it can also be scalp psoriasis. It can also be a fungal infection on the scalp, like tinea capitis. It can also be an allergic contact dermatitis of the scalp. So itching on the scalp can be differentiated and diagnosed in many ways. So I would suggest my viewers that if you have a dandruff problem or an itching issue, and if it doesn't go away, then do consult a dermatologist and don't delay it too much, because delaying a medical condition often results in a very difficult state for the patient and also for the treating doctor.
Okay. Absolutely. So you're saying that they should wait for ideally 7 days, and if it doesn't go, the itching in 7 days, then post that they should.
Yeah, that's my standard, that if you any itching or any pain or any rash on your body is like an indication from your body to pay attention to that part. It is like a signal which your body is trying to give you to pay attention to it, and not just try to hide it away using certain applications. Get it
Right.
diagnosed and get it treated in a proper way.
Right. Thank you, doctor. And doctor, could you please tell us about some external factors that could cause dandruff? Some people generally tend to observe that if they wash their hair too much, then the scalp gets dry. So, are there any other factors that help cause dandruff?
Yes, so dandruff, basically there is an excessive shedding of the cells which is happening. There is normally an enzyme on the scalp which helps in breaking the bonds between the sloughed off cells. So the cells can shed away on their own. But what happens in dandruff is that this enzyme doesn't act properly. It doesn't dissolve the connections between the cells. So these cells keep getting clustered and aggregated, and then they start falling in clusters, which we see as visible flaking. So definitely there is excessive flaking and scaling of the scalp and shedding of these flakes in dandruff. In a normal scalp, when we shampoo, then about 4,000 cells per centimeter square is shed during a regular shampooing session in a normal scalp. But in a dandruff condition or a seborrheic dermatitis, what we see is about 8,000 cells per centimeter square are shed, leading to an excessive flakiness or dryness and visible flakes on the skin and the body. So yes, over shampooing is a reason can be a reason for dandruff. Overexposure to sunlight, which also causes desquamation of the skin, is also a reason. Excessive combing, repeated combing can be one reason. Use of certain hair cosmetics like hair gels and setting gels can also lead to flaking and the dandruff-like condition. Certain medications also give rise to dandruff. Stress is also a known factor. So excessive stress can also increase this kind of scaling. Dust and dirt can also give rise to excessive dandruff. So these are certain external factors which can give rise to or increase your condition of dandruff.
Okay. Thank you, doctor. So, doctor, then how does a layperson control this? So, what would you recommend? Ideally, how many times should you shampoo in a week, or how many times should you comb your hair? Any guidance or any tips that you could share with our viewers?
So if you are suffering with dandruff, you should use one of these antifungal containing shampoos like ketoconazole or selenium sulfide or zinc parathione or paroxetinolamine. Any of such shampoos can be used. Initially, we give it for about alternate days, like 3 times in a week, and then slowly, gradually reduce the frequency to 2 times in a week. And then once the active phase is over, the dandruff problem can be maintained even with once a week shampooing. So I would say on an average, about twice a week shampooing is a good enough way. And for combing, twice a day combing is also enough. Some people have a habit of combing very often, more times in a day. So twice a day combing should be good.
Okay. Thank you, doctor. And doctor, could you please tell us about the etiology of dandruff? What is the cause of dandruff?
Yes, so the main thing in dandruff and seborrheic dermatitis is the excess sebum production which is happening. So sebaceous glands are present on various seborrheic areas of our body, such as the scalp, the face, the upper trunk, that is the chest and the upper back. These are the main seborrheic areas of the body. In dandruff and seborrheic dermatitis, we see that the sebum production is higher. Plus, there is infection with a yeast called Malassezia yeast or a fungus, which is seen more in these patients. Even P. acnes is an organism, bacterial organism, which is also can be a reason for dandruff. So these two are the major factors. Then there is also an immune disorder. There is lipase activity modification. The external humidity in the atmosphere can also be an etiological factor, right? And in certain conditions, it's also familial predisposition or genetic predisposition to having dandruff. Stress, as I said earlier, is also one reason. So this is the reason why it starts, and then it can be there for a long time. So we say that there is no cure as such for dandruff, but we can definitely treat it and keep it under check and under control as much as it doesn't affect you socially, doesn't affect your confidence, and doesn't make you socially awkward, and doesn't bother you as much.
Right. Thank you, doctor. And doctor, a lot of people who suffer from dandruff, they also complain of hair loss. So is there a connection between the two, between hair loss and dandruff?
Yes, there is a close connection because patients with severe dandruff also are seen having a shedding of hair or hair loss problem. So it is mostly preceding or accompanying dandruff. We see a lot of telogen effluvium cases. Dandruff is also known to exacerbate the androgenetic alopecias or the male and female pattern alopecias. So there is a connection between dandruff and hair fall. It could be due to the scales, or it could be also due to pruritus and excessive scratching of the scalp.
Okay. So in that case, would you recommend that the person try not to scratch the surface of the scalp?
Yes, definitely. You should keep your nails short. And with proper treatment, the itching goes down. So you don't feel that much itchy if you're under proper treatment. You don't feel the itch and you don't feel the need to scratch your skin. If you do, then do it gently. Don't scratch it very vigorously because that damages the skin of the scalp as well as the hair around on the scalp.
Okay. And doctor, finally, please tell us the treatment options for dandruff.
Yeah, so treatment is divided as whether we are treating the cause, and then we also have to treat the symptoms. So there are two parts to the treatment. For the cause, which is basically the Malassezia yeast, we rely more on the topical agents, which are antifungal agents, like I said, zinc pyrithione, ketoconazole, clotrimazole, climbazole, pyrophenolamine. All these are good antifungal agents, selenium sulfide, to control dandruff, which are given as shampoos. They can also be given as local applications if required, according to the severity of the case. We also sometimes, if it is, we also need to give oral antifungals and oral anti-inflammatory or antihistaminic agents to control the itch and the redness and inflammation. So the treatment of the cause is very, very important. And the second part is the symptoms. So the excessive proliferation and shedding of cells can be controlled by antimitotic agents like coal tar. And the excessive sloughing of the skin cells can be controlled by using keratolytics like salicylic acid. So salicylic acid can also be used as a shampoo base.
Okay. And doctor, generally people are a little skeptical of using shampoos which have a lot of chemicals. So is it that these shampoos that we use for treatment of dandruff or seborrheic dermatitis, are they generally more harmful, or we can use them like 3 times a week, or as you know?
So the commercially available over-the-counter preparations have a lesser concentration of these ingredients. Like medically, if we use a 2% ketoconazole, the commercially available shampoo with ketoconazole will be 1%. And similarly for other ingredients as well. And we use it only for the duration of time required to control the infection that is there. Right. And initially, if we use it alternate days or 3 times a week, we tend to reduce the duration and the frequency as we go ahead with our treatment. So we understand that these are medicines, and you should also understand as viewers that these are all medical agents that we are using and should be used under a medical guidance only. cannot be used on your own for a very long period of time without any guidance. So over the counter products you can try. If it helps you, if it doesn't, then the stronger ingredients are used by doctors using certain under certain protocols, and we make sure that it should not harm you in any other way. Shampoos which contain antifungal agents and salicylic acid are also known to cause dryness of the hair. So along with that, it is important to condition your hair after shampooing. Certain shampoos nowadays also contain inbuilt conditioners, so they give a better feel and texture to the hair. But additionally, you can always use a conditioner after using an antifungal shampoo. Conditioner should not be applied to the roots here. It should be only used on the hair strands to moisturize, keep your strands moisturized and looking healthy. And yes, certain leave-on serums can also be used because these shampoos tend to dry out your hair.
Okay. And doctor, is there any particular guidance with regards to the usage of these shampoos in terms of how long do you need to keep them applied on the hair, or any other details?
Yeah, I would say dandruff is usually a chronic condition. So it's not that you will take treatment and get rid of it. You will get the condition or a problem under control, but then maintenance is also part of treatment when we are dealing with dandruff and seborrheic dermatitis. So I would say once a week application of medicated shampoos can be required for a very long time.
Okay.
So yeah.
Okay. Thank you, doctor. So, doctor, with that, we come to the end of the questions. Let us take a look at the chat box if we have any questions from the audience. Okay, we have a question. Since it is the dryness of scalp that is the major reason that is causing dandruff, how can someone prevent that? The dryness of the scalp.
So for dryness of the scalp, oiling is normally not suggested in dandruff patients because we understood that there is already a higher sebum production in these patients, and the sebum is giving rise to the dandruff problem. So already excess oil is being produced. We don't recommend applying more oil on the scalp for these patients. But sometimes when we feel that it's very dry, we often tell patients to oil their hair just before shampooing. That can be one thing, and also using moisturizing moisture-based shampoos can also help here. Sometimes in DIY or home remedies, application of curd once or twice a week may also help in conditioning the scalp.
Okay. Thank you, doctor. We have another question that says, can dandruff lead to hair loss? I think you answered that already. However, would you
Yes.
like to still elaborate?
Yes, dandruff is seen to cause increased hair loss in patients. So there was a study which said that whereas in a normal individual we shed about 50 to 100 hair in a day, but in dandruff patients it was seen that 100 to 300 hairs were being shed every day. So there is definitely a link between the two. And we see a link between telogen effluvium and androgenetic alopecias when dandruff is concerned.
Okay. Our next question, doctor, says, can I cure my dandruff with an anti-dandruff shampoo?
So I discussed this as well. There is no cure for dandruff. We have to control it and treat it and keep it under control. And anti-dandruff shampoos are a good way to start treating your dandruff. And if it helps you enough, then thrice a week shampooing followed by then twice a week shampooing, and then once a week shampooing to keep it under check is the way to go. And so be prepared that it is genetically predisposed to some extent. So you and your other family member who are also maybe suffering with dandruff will have to use some ingredients to keep it under check.
Okay.
So see it as dry skin individuals need to use a moisturizer every day. So your scalp is having certain condition which can be kept under check by using a particular shampoo once a week.
Okay. Thank you, doctor. And our next question is, can dandruff spread among family members?
It doesn't spread person to person per se, but it is definitely seen in family members because of the genetic link. So there is a genetic link and it can be seen in family members.
Okay. And would you give any recommendations to people suffering from dandruff? Like they should not be sharing certain things like towels or caps to
Yes, of
maintain?
course, because there is an infection, there is a yeast involved here. So it is always better to keep your fomites and your personal use items separate to help in spreading of the disease. And like you said, towels, your combs, such things. If it's best to keep it separate.
And doctor, do vitamins and minerals have any role to play in helping controlling dandruff?
Uh, Yes, there is a role between keeping a healthy, basically keeping a healthy body helps in keeping a healthy scalp as well. And so, yes, multivitamins and hair supplements can help in preventing or keeping it under check to some extent, but that's not the way we treat dandruff. Also, certain vitamins are also uh, known to increase the presence of dandruff. So, drugs like B complex and zinc can are sometimes seen as the causative agents also. So, overtaking these vitamins is also not advisable. So, I would say go with your doctor's prescription on this.
Okay, that's some different information we've received today. That excess of some vitamins can also cause dandruff.
Yeah, it's also mostly seen in seborrheic dermatitis. So seborrheic dermatitis we see in areas like scalp, eyebrows, eyelashes, in the nasolabial folds, in the post-auricular folds, even on the center of the chest and the back. So it's a more severe form as we discussed, and the limits are outside the scalp. So dandruff is more limited to the scalp area, whereas seborrheic dermatitis is seen in other parts as well. Seborrheic dermatitis is also seen as having a very clear-cut border, which can extend on the forehead as well. So certain ways you can differentiate whether you're having a seborrheic dermatitis or a dandruff issue.
Okay, thank you, doctor. Our next viewer wants to know: can hair mask help in dandruff clearance?
Um, Hair mask containing antifungal agents can. So we also give certain applications to be applied on the scalp area overnight when we feel the need that it is more severe and it is required. So we do give applications to be applied on the scalp area, but the commercial hair mask which we apply on the hair as well are not shown to have any beneficial effect. But definitely medicated creams that we suggest to our patients to be applied on the scalp overnight, which can also be seen like a mask, can definitely help.
Okay. And our next viewer would like to know: does diet play an important role during dandruff?
There is no clear link between diet and dandruff, but staying away from high glycemic index foods, sugar, junk, can improve your situation and can improve the condition. And also exercise to some extent can has shown to reduce the severity of dandruff, because exercise helps in cutting down the stress hormones which are a cause. So exercising on a regular basis and keeping your scalp clean and having a healthy balanced diet helps.
Okay. And doctor, can hair dyeing lead to dandruff?
No, so as I said, everything, all scaling on the scalp is not diagnosed as dandruff, right? So there are other conditions like contact allergy or allergic contact dermatitis. Hair dyes can give rise to contact dermatitis or allergies on the scalp that can be viewed as excessive flake and itching and redness. But maybe it's not dandruff, and it's another condition called contact allergy, which needs to be treated in a very different way. So if you feel that your dye is giving rise to itching and dandruff, then it should be diagnosed by a dermatologist, because it can be something else as well. It's not always dandruff. Every kind of shedding of flakes and itching is not always dandruff. It can be something else. There are other differential diagnoses which we also keep in mind while we give a diagnosis. So get it checked from a expert.
Right. It's in this case, it's best not to assume and start self
Yes.
medication.
Self treatment and using
Yes,
ketoconazole shampoos in such a case will not help.
absolutely. So it's best to go to a specialist and expert. Right.
That's true.
And does exercise, Doctor, our viewer wants to know if exercise can play any role in controlling dandruff.
I already said that exercise is known to release endorphins in the body, which is known to cut down the stress hormones, and stress is a cause for increase in dandruff situation. So definitely, if we help reduce stress in any way, and exercise is one way, best way to do that. It will help you.
Right.
Also, many patients feel that dandruff is because of unclean habits or not cleaning your scalp much and being dirty. So no, it's not like that. Dandruff doesn't happen by if you're not hygienic. It is not related to so much to hygiene, but having a healthy scalp and a clean scalp, like shampooing thrice a week, is enough. Don't overdo it. Many people feel that shampooing every day and twice a day will help in treating dandruff because it's due to dirt and unhygienic habits, but that's not true. Over shampooing can also exacerbate the condition. So just stick to your regime, the doctor's regime.
Okay. Thank you. And doctor, a last question. Teenagers especially face a lot of issues with dandruff, and they don't really know how to deal with it. Also, because they're so young, they feel awkward to talk about it many times. So, what are the tips that you would give to them?
Yes, so dandruff is most commonly starts around puberty when the hormones are changing. And dandruff is basically physiological shedding of cells. But if you feel it's too much and it's making you socially awkward, it is giving rise to low confidence levels and awkwardness like that, then take medical help. Before going to a doctor, you can also try using the shampoos which I named, like zinc pyrithione, ketoconazole, clotrimazole. These shampoos can also help in controlling the mild cases. So the commercially available ones can be tried. If it helps, it's good, and it's there is a way to cure it, treat it. I mean, and keep it under check. So don't get overwhelmed with the situation. Take a proper advice, and then you'll be more comfortable with the condition, and when you understand why it's happening.
Okay. Well, with that, we've come to the end of all the questions. Thank you so much for your time, Dr. Kopikar. It was indeed very insightful and very informative. And I'm sure our viewers are very happy with all the answers. So it was indeed a pleasure to have you with us. Thank you so much once again for your valuable time.
It was a pleasure for me too. Thank you.
Thank you. Thank you, Doctor. All right, ladies and gentlemen, with that, we come to the end of our session today on hair care in winter. We'll see you again. Until next time.